So our next panelist today is David Cade, who's the CEO of the American Health Law Association. David was 14 years as Deputy General Counsel at the Department of Health and Human Services, where he supported program policy and legal positions around health insurance and programs for Medicare beneficiaries. He worked to develop some creative solutions to support Medicaid. So he's really got a broad background in healthcare financing, especially around government programs. So let me turn it over to you, David.
Great. Thank you, David. Good afternoon and good evening, everybody. It's a pleasure to be with you. A couple things I just want to sort of share. In addition to the introduction, one of the things that sort of where I sit is I wear two hats or three hats. One, I am a small business. The American Health Law Association is a 501c3 healthcare education association for anyone involved in health law. So that hat we wear throughout the day. We were having a lot of rich discussion about small business preparation, small business reaction, how to protect your workers, how to protect your mission, and we can spend some time drilling down about that. The other hat, as David said, I've been inside the bubble for a long time. I've done a lot of work with SARS and MARS and Ebola during my tenure at HHS. The pandemic preparation, disaster preparedness and recovery, crisis management, all that stuff, tabletops, continuity of government. That's another part of what I have done and what I hope to be able to bring to you this afternoon in this session. And then the other is, as a Health Law Education Association, beyond the care and feeding of our staff and how we function, it's making sure that we stay connected with the larger community. And again, there were a lot of discussions about that throughout the day. And so that's sort of the third angle of the information that I kind of want to share and impart with folks today. A couple things just in the nature of some, I guess, quick observations. It's sort of the sum total of today and how we are operating. And again, one of the lessons learned from inside the bubble at HHS, and that is, in a pandemic, we are all patients. I think we get a little sideways when we start talking about it, is who's infected and who's not, who's asymptomatic and who's not. But in a pandemic, I think a proper framework is we are all patients and we have to govern ourselves as patients. And that requires us to take the precautions to prevent symptoms. And if you have symptoms, to be able to react and address them. And so that's sort of one element that I think is important that we keep in mind. Throughout today and all the connections we make as we are small business owners and experts in the field, it's about how we give advice and counsel to others. But a principal part is we always have to remain conscious of the fact that in a pandemic, we are all patients. The other theme is follow the science. The evidence evolves. What we knew in March is different from what we know today. And as the science continues to evolve, it'll be different tomorrow and in our tomorrows. It's important to remember that we have to follow the science and we have to be willing to adjust when the science leads us to different and new evidence-based conclusions. This is where a lot of our decision makers get tripped up. If you start building a plan and lock it in on day one with the information you have, you're very limited and it can be problematic. And so one of the critical elements is that in following the science, you have to be willing to change and adjust as necessary. The third prong is excellence in healthcare requires excellence in health law. And again, this is where we come to sort of knit the community together. You have to stay grounded with what the law is requiring and how to make sure that your actions, your policies are legal and that you are ensuring compliance with the rules and procedures. One thing that was again a theme throughout the day and is definitely true is if you are not compliant, whether it's a state enforcement agency or a federal enforcement agency, the enforcement will come. And it will be problematic after we have worked our way through and are still toiling with a lot of challenging issues in the midst of the pandemic that you are found to be out of compliance. So again, excellence in healthcare requires excellence in health law. You have to stay grounded with what the rules and procedures are. The fourth point that I wanted to raise is to stay educated and get grounded and stay informed. Again, a theme throughout the day that's critically important. Folks were sharing, where do they go? How do they get informed? Folks talked about CDC, Tim mentioned that, OSHA, NIOSH. There are a tremendous number of resources. So you have to stay connected and understand what the rules are, from the federal government all the way down to the state and local government, because those will be the elements that govern your policy actions and your decisions. We and many others also offer key pieces of information that can help you govern and manage your program. For us, ahla.org/coronavirus. We created a coronavirus hub that is a compilation of podcasts, articles, webinars, lots of information linking what's going on in this country and around the world. Where are the hot zones? What are the state laws that are governing and how they change? It's a dynamic resource that I urge you, and I'll put it in the chat also to make sure that you guys have access to it. And we update it, like everybody should, to make sure that the information stays relevant and dynamic. We've covered issues about preparing providers for a vaccine. There's discussions throughout the day about when the vaccine comes, what are the distribution plans, how do we handle it locally, what's the impact of making sure that it's around the world, how do we deal with those individuals and communities where the distribution isn't going to happen, what's the impact on children who may not have been part of the test, and as we figure out kind of what's going on. One thing to note that I think was shared today, and if not, it's out there, is that while the schools have opened up in a variety of ways, some still virtual, school-aged children are not getting vaccinated at the rate that they were previously. And there's been a noticeable drop-off once this virus kicked up. Could be a function of the fact that a lot of folks aren't going to their primary care doctors. Those well baby visits and those early school physicals haven't been happening. I don't know necessarily the reason why, but one thing that is a noticeable fact is that there's a distinct dip in folks getting vaccinated. And so one of the things that we have to watch for is when we start to pivot and look for this vaccine, how's it rolled out? How's it going to affect the community? And the other thing is that as we have to make sure that the vaccine is distributed in a way around the world that protects everyone, it is seasonal. And so the sense is, based on the information I'm receiving, is we will always need to adjust and react to the COVID season. And some discussions about having it integrated into the flu vaccine, because there's a recognition that as COVID viruses exist, we are not going to be done with this. It'll be part of the vaccination program that we will be with for a while. Lastly, I just want to touch on 4 quick points. One is flexibility. One is making sure that we understand why we are doing what we're doing, communicate and educate, and again, the laws and the rules and the regs. So when I put my hat on as a small business owner, one of the things that's critically important is making sure that we are flexible. Our organization has folks who are locally congregated in the DC area, and we have people who have been remote throughout the country. The rules are different in different locations. So one of the things that's very important is that as a business owner, we have to understand what the rules are, but more importantly, we have to make sure that our employees are safe and that they are able to perform the essential functions. We've been fortunate because we built in previously an IT infrastructure that allowed us to work remotely with great success and to make sure that our products and services are available through the digital world. So we were a little bit ahead of the curve. Our business operations had to pivot because in-person conferences, as you know, were restricted and are restricted. And so we've had to pivot there. When people talk about returning to work, I mean, some of you, when you talk about essential workers, you are on the front line. But there's a whole part of the business community that has to ask the question, why, and if so, when would we force people to come back to work? For many organizations, many small businesses, if you're able to perform your essential functions remotely, and you've been doing it for almost a year now, it's a critical question to ask, why and when would you bring folks back? And under what circumstances? And what protections need to be in place? So that links to the critical important issue of education and communication. Those are 2 critical issues that need to be shared with your employees, with the workforce. And the other, which we started out with, and we will continue to come back to that, I think, throughout the rest of the afternoon, is that we have to understand the requirements that exist that allow an employer to continue to protect the workforce, to protect the customers who may be coming in and interacting with the workforce. That is one of the most important things that will allow us to be grounded and to make sure that we stay on the right side of compliance and regulations.